are looking at a very important, that is the causes of the AV disorders, that is acid-base disorders. So in terms of the acid-base disorders, firstly we'll see the metabolic alkalosis. So metabolic alkalosis. So here the causes, it can be due to, there can be ketoacidosis. So it can be due to ketoacidosis. Next, it can be to the lactic acidosis as well. Ketoacidosis, lactic acidosis. Next, even in cases of CRF, there is a chronic renal failure, then the salicylate intoxication. Then it can also be due to the methanol. It can be due to the methanol or the formaldehyde. This is the methanol or the formaldehyde intoxication. Next, we also have the ethylene glycol intoxication. Next, it can also be as a result of this metabolic acidosis. So it can be a result of the diarrhea. So in case of diarrhea also we have metabolic acidosis. Then also the renal tubular acidosis can also be a cause of this metabolic acidosis. Next, we'll move on to the metabolic alkalosis. So what happens in the metabolic alkalosis? So in terms of the metabolic alkalosis, there is something known as vomiting. So we have vomiting. This is all cause of the metabolic alkalosis. Then it can also be due to the hyperaldosteronism. Next, it also can be occurring due to the loop. It can occur due to the loop or the thiazide diuretics. Next, we'll move on to the respiratory acidosis causes. So what happens during respiratory acidosis? It can be due to the opiates. So it can be due to opiates, or it can be due to the sedatives and the anesthesia. So other causes of the respiratory acidosis, it can include the Guillain-Barré syndrome, GB syndrome, and it can also be due to the polio. It can be due to the ALS as well as the multiple sclerosis. Next, we will look at the airway obstruction. And we'll also look at the adult respiratory distress syndrome. So this is the ARDS as well as the COPD. Next, we are going to look at the respiratory alkalosis. So what does this respiratory alkalosis include? So this includes there is pneumonia, there is pulmonary embolism, as well as the alkalosis which can take place in case of the high altitude, as well as in case of the psychogenics. So this video was about the causes of acid-base disorders. We have seen the various types and we've seen the causes, that is metabolic acidosis, respiratory acidosis, to name a few. And to learn and grow daily like this, please do subscribe.